breathing over 25 beats a minute, heart rate going over 130 beats a minute, and if they have an O2 sound less than 90. Those are all indications for using positive pressure ventilation or when you're looking towards possible recommendations.
Are there any thoughts on oxygen and levels of oxygen for these patients? Are we doing less or more the same?
Get there in a second.
If the issues are happening at the level of the alveoli, what does an intubation do?
Intubation actually does two things. One is it gives you and protects your airway so you can give them extra oxygen. So you're super saturating the oxygen in the air. Because oxygen in the air is 21%, you can give them 100% directly to the air. The second is that you're going to give them positive pressure. It's something called P. So positive and expiratory pressure. That actually pushes the oxygen from the alveoli in. So that changes this dynamic here. And it's going to push not just the oxygen, but actually also pour some fluid. Quite that much. So it pushes. That's what the oxygen does. The second thing is that they're going to go into respiratory failure at some point, and they won't be able to breathe again because their work of breathing is so hard. Then they sort of take over and then they can't oxygen. So that will enable you to retain that airway, to retain and protect the airway, maintain and protect the breathing, and give them oxygen. Okay. So they're breathing fast, they're short of breath, hopefully they're hypertensive and not hypotensive. You'll see that they're going to be using their accessory muscles. Right? They're breathing with their whole bodies, they're breathing with their shoulders, you'll see them breathing with their necks, right? Using accessory muscles to breathe. If you start listening to them, you'll hear rails which feel like Velcro, or sound like Velcro being pulled apart. You may hear a wheezing like we talked about before. If you listen to their heart, you might hear an S3 gallop. I don't know the first gallop. So as you're listening to the heart, do you guys normally listen to the cardiac sound when you do the examination? Have you tried to? So, the heart does love dog. You heard that? When you're hearing a gallop, which is the increased pressure into the ventricle, it's going to sound like this. That third sound is the increased pressure at the end of the cardiac cycle. You can also hear this, where it goes. That's increased pressure mostly from high blood pressure. So we call this. Yep. So you might hear a gallop. You may see that their jugular veins are distended. You may see that they have peripheral edema, but peripheral edema is not necessary. Remember, this is an acute process. Peripheral edema is not a chronic process. Other testing that you can do EKGs. Don't do EKGs, which is a wonderful amount of show. EKGs. The EKG will not diagnose heart failure, but it will diagnose things that you're worried about. So it will diagnose someone having a heart attack, which can cause you that heart failure. A patient who came in two nights ago, who came in with heart failure, and is really having a heart attack. It was missed. I missed it. His EKG showed it, but he wasn't having chest pain. Sat on him, the blood test came back, and he was in EKG will show ischemia, an infarct, it will show atrial fibrillation, it will show tachycardia. So it gives you a good issue with other cardiovascular diagnoses. The chest x-rays are important. You can see the edema, or you can see that they have pneumonia or something else. And then a series of labs. Okay, so what are you going to do? So the first thing you want to do is you're going to get their vitals, you want to get their saturation, you want to make sure that they're sure. You're hoping that they have high blood pressure, because high blood pressure is easier. Low blood pressure, we're not talking about an augment the flow yourself, so it's something that you really comfortable with. Get their saturation. Their saturation is over 90. You can give them oxygen. Most people are giving them oxygen, but there's a movement to not giving them oxygen if their saturations are adequate. And what defines adequate? Well, we said if it's less than 90, we're talking about giving them more positive pressure ventilation, non-invasive positive pressure ventilation, with a 5 mask or something like that. Usually, I say 90 to 94, you're giving them oxygen. above 94, and they look like they're comfortable, even though they may be breathing all hard, you may not want to give them oxygen. That's not in the guidelines yet, they haven't changed that. Their concern is, just like if they're heart attacks, in patients who have adequate oxygenation, if you give them 100% oxygen, you may be causing them to have supersaturation of oxygen, and it may cause the constriction of the capillaries. And if it causes that, it can cause actually ischemia. That hasn't been settled yet.
Could that happen in the 10 minutes that we take them to the hospital, or is that something over a long period of time?
It happens, it's gonna happen right as you're crossing over the border.
I want a great thing to do.
I don't know that answer. I don't know that answer. Because what we're talking about with this oxygen stuff is all theory. We've seen it in rat models, but we've never proven that it's been dangerous, and we've been doing it forever. But there is now one study that's doing it for acute mines. I don't know if they're doing a study in heart failure. But the guidelines, the European guidelines that came out 2 days ago, which is what this is based upon, said they consider not using oxygen in patients who have normal saturation.